Everyone. Here we are going to discuss the important topic that is hypertensive vascular disease. So in your university exam, you usually get a short question on the three important morphological changes which are seen in the blood vessel. One of the three important morphological changes in hypertensive vascular disease, that is either you get a short question on hyaline arteriosclerosis or hyperplastic arteriosclerosis or necrotizing arteriolitis. So we will be discussing all three one by one in detail. So let's start the topic. You can see we are starting the topic hypertensive vascular disease. So first of all, I will let you know the introduction, in which I will let you know what is hypertension, what is the classification of hypertension, the types of hypertension, how the blood pressure is regulated. Then we will come on the topic that is vascular pathology in hypertension, in which we will discuss three different morphology: hyaline arteriosclerosis, hyperplastic arteriosclerosis, or necrotizing arteriosclerosis. If overall question comes in your exam as vascular pathology in hypertension, you have to describe all three and draw the well-labeled diagram of all three. But if short question is asked on any one of them, you have to write that portion only. So let's start the topic. So before understanding this topic, you must understand the layers in the artery. So here you can see the artery have three layers. In the wall of the artery, the three layers are present. The innermost layer, you can see this is the artery. The wall of the artery have three layers. The innermost one is intima, the middle one is media, and external one is adventitia. So innermost is intima, media, and externa. These are the three layers present in the wall of the artery. Histologically, you can see the same here. You can see the innermost is lined by the endothelial cells. This is intima. Intima is lined by endothelial cell. Intima. This one is media. You can see in the middle there is media. The media contains smooth muscle cell. This is media. It contains smooth muscle cell. And outermost is adventitia. You can see this is the outermost. This one is adventitia. So you can see this is the three layers. Now let's start the topic, hypertensive vascular disease. What do you mean by hypertensive vascular disease? The normal blood pressure in human is 120 by 80 mm of Hg. 120 is the systolic blood pressure, 80 is diastolic blood pressure. So when the heart is doing systole, you can see the blood pressure is 120. And when the heart is doing diastole, then the blood pressure is 80. That is regarding the ventricle, the left ventricular systole and diastole we are talking. So whenever the blood pressure is more than 120 by 80, it is known as hypertension. So whenever you can see this is the artery. Can you see the wall of the artery? So whenever the blood is exerting more pressure on the wall of the artery, so the wall of the artery are getting more pressure. So in the wall of the artery, the three layers are present, intima, media, and externa. They have more pressure constantly because of hypertension. You can see here, they have more pressure. So some changes occurs in the wall, and that is known as hypertensive vascular disease. So basically, in hypertensive vascular disease, the changes occur in the wall of the blood vessel because of constant pressure, the wall of the blood vessel. So that is the thing. So elevation in blood pressure is known as hypertension. So what is the classification of hypertension? What are the types of hypertension? Normal blood pressure is 120 and 80. Systolic is 120 and diastolic is 80. When the blood pressure, systolic blood pressure is 120 to 140 and diastolic is 80 to 90, it is known as pre-hypertension. It is not hypertension, it is pre-hypertension. When the systolic blood pressure is between 140 to 160 and diastolic is 90 to 100, it is known as stage 1 hypertension. When systolic is 160 to 200 and diastolic is 100 to 140, it is known as stage 2 hypertension. Stage 1 and stage 2 hypertension are the type of benign hypertension. But when systolic is more than 200, severe, sudden rise, and diastolic is more than 140, sudden onset, it is known as malignant hypertension. So can I say we can divide the hypertension into two categories? What are the two categories? Benign and malignant. These are the two categories we are dividing the hypertension. So this is the classification of the hypertension. What is hypertension? The normal blood pressure is 120 by 80. We divide the hypertension into two categories, benign and malignant. From 120 to 140, up to 140, and from 80 till 90, this is pre-hypertension. So hypertension occurs after 140 and after 90. So in benign hypertension, the systolic is 140 to 200 and diastolic is 90 to 140. In malignant, it is more than 200 and it is more than 140. So systolic more than 200 and diastolic more than 140. Sudden rise, it's known as malignant. Malignant is a misnomer. It's not malignancy. It's not cancer. It is malignant hypertension. So it is nothing to relate it to the neoplasia. So benign